Fundamental word structure. Chapter 1. Outline. Comprehension of fundamental word structure 2. Fundamentals of word structure 2. Principles of component parts 3. Identification of medical words, spelling, formation of plural endings, use of abbreviations, pronunciation, building your medical vocabulary. Abbreviations, medical and surgical specialties, study and review. Objectives. On completion of this chapter, you will be able to describe the fundamental elements that are used to build medical words. List 3 guidelines that will assist you with the building and spelling of medical words. Explain the use of abbreviation when writing and documenting data. Analyze, build, spell, and pronounce medical words. Identify and define selected abbreviations. Describe selected medical and surgical specialties, giving the scope of practice and the physician's title. Complete the study and review section. Comprehension of fundamental word structure. Medical terminology is the study of terms that are used in the art and science of medicine. It is a specialized language that, with its origin arising from the Greek influence on medicine. Hippocrates was a Greek physician who lived from 460 to 377 BC, and whose vital role in medicine is still recognized today. He is called the father of medicine and is credited with establishing early ethical standards for physicians. Because of advances in scientific computerized technology, many new terms are coined daily. However, most of these terms are composed of word parts that have their origins in ancient Greek or Latin. Because of this foreign origin, it is necessary to learn the English translation of terms when learning the fundamentals of word structure. Fundamentals of word structure. The fundamental elements in medical terminology are the component parts used to build medical words. The abbreviations used for component parts in this text are P prefix, R root, CF combining form, and S suffix. The key to learning medical terminology is through a word building technique used in this text. Combining forms and word roots are integrated into each chapter of the text according to body system or specialty area. Suffixes and prefixes are presented in chapters 2 and 3 and then will continue to be repeated throughout the text. To build your medical vocabulary, all you have to do is recall the word parts that you have learned and then link them with the new component parts presented in each chapter. Prefix. The term prefix means to fix before or to fix to the beginning of a word. A prefix can be a syllable or a group of syllables. Prefixes are united with or placed at the beginning of words to alter or modify their meaning or to create entirely new words. For example, the word excision means the process of cutting out, surgical removal. Note its component parts. X, P, or prefix meaning out. Cis, C-I-S, R or root meaning to cut, ion or eon, incision, in, S or suffix meaning process. Word root. A root is a word or word element from which other words are formed. It is the foundation of the word. The root conveys the central meaning of the word and forms the base to which prefixes and suffixes are attached for word modification. For example, the word malformation means the process of being badly shaped, deformed. Note its component parts. Mal, P or prefix meaning bad. Format, root or R or root meaning a shaping. Ion or eon or in, I-O-N. S or suffix meaning process. Combining form. A combining form is a word root to which a vowel has been added. A combining vowel, A, E, I, O, or U, links the root to the suffix or the word root to another root. The combining vowel does not have a meaning of its own. The vowel O is used more often than any other to make combining forms. Combining forms can be found at the beginning of a word or within the word. For example, the word chemotherapy means treatment of disease by using chemical agents. Note the relationship of its component parts. Chemo, CF or combining form meaning chemical, therapy, S or suffix meaning treatment. Chemotherapy, chemical treatment. Suffix. The term suffix means to fasten on, beneath, or under. A suffix can be a syllable or group of syllables united with or placed at the end of a word to alter or modify the meaning of the word or to create a new word. When you break down a word or understand it, or when you give the meaning of the word or read its definition, you usually begin with the meaning of the suffix. For example, the word gastroma means a tumor of the stomach, and the word gastritis means inflammation of the stomach. Gaster, Gastr, R or root meaning stomach. Oma, S or suffix meaning tumor. Gaster, Gastr, R or root meaning stomach. Itis, S or suffix meaning inflammation. Word roots and combining forms, together with the definitions, are included in each chapter according to the cell, tissue, organ system, or element they describe. This arrangement makes it possible for you to form association between medical terms and the various body systems to reinforce the learning process. This text provides you with a general anatomy and physiology overview for each of the body systems that it includes. Principles of component parts. As you learn definition for prefixes, roots, combining forms, and suffixes, you will discover that some component parts have the same meaning as others. This occurs most often with words that relate to the origins of the body and the diseases that affect them. The existence of more than one component part for a particular meaning can be traced to differences in the Greek or Latin words from which they originated. Most of the terms for the body's organs originated from Latin words, whereas terms describing diseases that affect these organs have their origins in Greek. Examples follow. Uterus, Latin word for one of the organs of the female reproductive system, the womb. Hyster, Greek R, root for womb. Hysterectomy, surgical excision of the womb, from hyster, root, R, root, meaning womb plus ectomy, suffix, S, suffix, meaning surgical excision. Metry, Greek combining form, Greek CF, combining form for uterus. Myometrium, muscular tissue of the uterus, from myo, combining form meaning muscle, plus metry, combining form meaning uterus, plus suffix meaning tissue. Identification of medical words. When identifying medical words, you will learn to distinguish between and select the appropriate component parts for the meaning of the word. For example, the word microscope means an instrument for examining small objects. Note the following: micro plus scope, not scope plus micro. With the proper placement of component parts, prefix plus suffix, the definition translates micro equals small and scope instrument for examining. Spelling. Medical words of Greek origin are often difficult to spell because many of them begin with a silent letter or have a silent letter within the word. The following are examples of words that begin with silent letters. Silent beginning, GN pronounced N. Medical term, gnathic, 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 pronounced gnathic. KN pronounced N. Medical term, knuckle, KNUCKLE, knuckle. Silent beginning, MN, pronounced N. Mnemonic, mnemonic. PN, pronounced N. Pneumonia, PNEUMONIA, pneumonia. PS, pronounced S. Psychiatrist, PSYCHIATRIST, psychiatrist. PT, pronunciation T, medical term ptosis, PTOSIS, ptosis. The following are examples of medical terms that contain silent letters within the word. Silent letter G. Medical term phlegm, 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 pronounced Flem, phlegm. Silent letter P. Blepharotosis, medical term blepharotosis, Blepharoptosis, blepharotosis. Correct spelling is extremely important in medical terminology because the addition or omission of a single letter can change the meaning of a word to something entirely different. The following examples illustrate this point. Term letter changed, abduct, meaning of term, to lead away from. Term letter, and then adduct, abduct, abduct, to lead away from the middle. Adduct, adduct, to lead toward the middle. Arteritis, inflammation of an artery. Arthritis, inflammation of a joint. Arteritis, arteritis, inflammation of an artery. Arthritis, 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 inflammation of a joint. Following are some of the prefixes and suffixes that often contribute to spelling errors. Prefixes and suffixes that are frequently misspelled. Anti, ante, anti, before, forward. Anti, 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 against. Ecto, 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 out, outside, outer. Endo, 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 within, inner. Hyper, 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 above, beyond, excessive. Hypo, 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 below, under, deficient. Inter, inter, between. Intra, intra, within. Para, para, beside, alongside, abnormal. Peri, peri, around. Per, per, through. Pre, pre, before, in front of. Pro, pro, before. Super, super, above, beyond. Supra, supra, above, beyond. Poiesis, 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 formation. Ptosis, ptosis, ptosis. Prolapse, drooping, sagging, falling down. Ptysis, 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 spitting. Ragia, agia, rrhagia, to burst forth, bursting forth. Rage, rrhage, rage, to burst forth, bursting forth. Raphy, rrhaphy, raphy, suture, rhea, rrhea, rhea, flow, discharge. Rhexis, rrhexis, rhexis, rupture. Scope, 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 instrument for examining. Scopy, 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 visual examination, to view, examine. Tomy, tome, tome, instrument to cut. Tomy, tomy, incision. Tripsy, 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 crushing. Trophy, 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 nourishment, development. Follow these guidelines for building and spelling of medical words. If the suffix begins with a vowel, dropping the combining form from the combining form and add the suffix. For example, gastro, stomach, plus oma, tumor, becomes gastroma, when we drop the O from gastro. 2. If the suffix begins with a consonant, keep the combining vowel and add the suffix to the combining form. For example, lipo, fat, plus lysis, destruction, becomes lipolysis. And we keep the O on the combining form lipo. Lipolysis. Lipolysis. Keep the combining vowel between two or more roots in a term. For example, electricity, plus cardio, heart, plus gram, record, becomes electrocardiogram. And we keep the two combining vowels. To change the following singular endings to plural endings, substitute the plural endings as illustrated. A as in bursa to AE as in bursae. AX as in thorax to ACES as in thoraces, or ES as in thoraxes. EN as in foramen to INA as in foramina. IS as in crisis to ES as in crises. IS as in iris to IDS as in irides. IS as in femoris to A as in femora. IX as in appendix to ICES as in appendices. NX as in pharynx to GES as in phalanges. ON as in spermatozoan to A as in spermatozoa. as in ovum to A as in ova. US as in nucleus to I as in nuclei. Y as in artery to I and add ES as in arteries. Use of abbreviations. An abbreviation is a process of shortening a word or phrase into appropriate letters. It is used as a form of communication in writing and documenting data. More than 1,000 medical abbreviations are in use today, and however, more will be created as new treatments and procedures are developed. When using abbreviations, caution must be exercised. Many have more than one meaning, such as ER, which means emergency room, and endoplasmic reticulum, and PA, which means physician assistant, postural anterior, and perinaceous anemia. It is essential that you use or translate the correct meaning for the abbreviation being used. If there is any question about which abbreviation to use, it is best to spell out the word or phrase and not use an abbreviation. The Institute for Safe Medication Practice, ISMP, and the Joint Commission on Accreditation of Healthcare Organizations, JCAHO, have developed a list of abbreviations considered to be dangerous because of the potential of misinterpretation. It is recommended that facilities using abbreviations for documentation keep a list of approved and unapproved abbreviations on hand and readily accessible. For more information on this list, you can go to http www.ismp.org and http www.jointcommission.org. In each chapter of this text, you will find selected abbreviations with their meanings. These abbreviations are in current use and are directly associated with the subject of the chapter. In the appendices, you will find an expanded alphabetical list of commonly used abbreviations and symbols. The abbreviations are presented using capital letters without periods, except in those cases where lowercase letters and periods represent the norm or preferred method. Pronunciation. Pronunciation of medical words may seem difficult. However, it is very important to pronounce medical words with the same or very similar sound to convey their correct meaning. As in spelling, one mispronounced syllable can change the meaning of a medical word. This text uses phonetically spelled pronunciation guide adapted from Taber's Cyclopedic Medical Dictionary, and you should practice speaking each term aloud when working with the various lists of medical terms and vocabulary words. Accent marks are used to indicate stress or certain syllables. A single accent mark is called a primary accent and is used with the syllable that has the strongest stress. A double accent is called a secondary accent and is given into syllables that are stressed less than primary syllables. Diacritics are marks placed over or under vowels to indicate the long or short sound of the vowel. In this text, the macron shows the long sound of the vowel. The breve shows the short sound of the vowel, and the schwa indicates the uncolored central vowel sound of most unstressed syllables. For example, antiseptic, or diathermy, therma. This section provides the foundations for learning medical terminology. Review the following alphabetized word list. Note how common prefixes and suffixes are repeatedly applied to word roots and combining forms to create different meanings. P prefix, R root, at CF combining form, S suffix. Pink words, terms not built from word parts. Asterisk indicates word covered in the pathology spotlight section. And CD-ROM, check the CD-ROM for more information. Building your medical vocabulary. This section provides the foundation of learning medical terminology. Review the following alphabetized word list. Note how common prefixes and suffixes are repeatedly applied to word roots and combining forms to create different meanings. P prefix, R root, CF combining form, S suffix. Pink words, terms not built from word parts. Asterisk indicates words covered in the pathology spotlight section. CD-ROM, check the CD-ROM for more information. Abate, no word parts. Definition, to lessen, decrease, or crease. Abnormal, AB, abnormal. Ab, prefix, away from, norm, root word, rule, all. Suffix, pertaining to, away from rule. Pertaining to, away from the normal or rule. Abscess, no part, type, or meaning. Localized collection of pus which may occur in any part of the body. Acute, AC, acute. Sudden, sharp, severe, a disease that has a sudden onset, severe symptoms, and a short course. Adhesion, adhes, root, stuck to. Ion, ion, suffix, process. Process of being stuck together. Adhesion, process of being stuck together. Afferent, carrying impulses toward a center. Ambulatory, ambulatory, condition of being able to walk, not confined to bed. Antidote, substance given to counteract poisons and their effects. Antipyretic, anti prefix, against. Pyrete, root word, fever. Ic, suffix, pertaining to an agent that works against fever. Antiseptic, anti prefix, against, sept, root word, putrefaction. Ic, suffix, pertaining to an agent that works against sepsis, putrefaction. Antitussive, anti prefix, against, tus, root word, cough, iv, suffix, nature of, quality of, pertaining to an agent that works against coughing. Apathy, condition in which one lacks feelings and emotions and is indifferent. Asepsis, asepsis, prefix, a prefix, without, sepsis. S, decay, without decay, sterile, free from all living microorganisms. Autoclave, apparatus used to sterilize articles by steam under pressure. Autonomy, auto, prefix, self, nom, root word, law. Y, suffix, condition, condition of being governed to function independently. Auxiliary, axle, root, armpit. Airy, suffix, pertaining to the armpit. Axle is armpit. Biopsy, bio, combining form, life, opsy, suffix, to view. Surgical removal of a small piece of tissue for microscopic examination used to determine the diagnosis of cancer or other disease processes in the body. Cachexia, cachexia, hexia, cac, prefix, bad, Hexia, suffix condition, condition of ill health, malnutrition and wasting, and may occur in chronic diseases such as cancer and pulmonary tuberculosis. Centigrade, C, centi, prefix 100, 100th. Grade, suffix a step. Having 100 steps or degrees like the Celsius temperature scale, boiling point equals 100 degrees Celsius, and freezing point equals 0 degrees Celsius. Centimeter, cm. Centi, prefix 100, 100th. Meter, suffix measure. Unit of measurement in the metric system, 100th of a meter. Centrifuge. Century, combining form center. Fuge, suffix to flee. Device used in a laboratory to separate solids from liquids. Chemotherapy, chemo, suffix or combining form chemical. Therapy, suffix treatment. Treatment using chemical agents. Chemo is chemical. Chronic, pertaining to time, a disease that continues over a long time, showing little change in symptoms of course. Diagnosis, DX. Dia, prefix through, gnosis, suffix knowledge, determination of the cause and nature of a disease. Diaphoresis, dia, prefix through, phoresis, suffix to carry through sweat glands, profuse sweating. Disease, lack of ease, an abnormal condition of the body that presents a series of symptoms that sets it apart from normal or other abnormal body states. Disinfectant, dis, prefix apart, infect, root, to infect, and suffix forming. Chemical substance that can be applied to objects to destroy pathogenic microorganisms such as bacteria. Efferent, carrying impulses away from a center. Empathy, state of projecting one's own personality into the personality of another to understand the feelings, emotions, and behaviors of the person. Epidemic, epi, prefix upon, derm, root, people, dem, not derm, dem. Epi, prefix upon, dem, root, people, ick, suffix pertaining to among people, the rapid and widespread occurrences of an infectious disease. Etiology, etio, combining form, cause, logi, suffix, study of the causes of disease. Excision, ex, prefix out, cis, root, to cut, ion, suffix, process of cutting out, surgical removal. Febrile, febrile, pertaining to fever, febrile. Gram, unit of weight in the metric system, a cubic centimeter or milliliter of water is equal to the weight of a gram. Heterogeneous, genius, heterogeneous, hetero, prefix different, gene, root, formation, produce, os, ous, suffix, pertaining to a different formation. Illness, state of being sick. Incision, in, prefix in, into, cis, root, to cut, ion, eon, suffix, process of cutting into, incision. Kilogram, kg, kilos, combining form 1,000, grams, suffix, a weight. Unit of weight in the metric system, 100 or 1,000 grams. Liter, L, unit or volume of the metric system equal to 33.8 flowing ounces or 1.0567 quarts. Macroscope, macro, combining form, large, scop, root, to examine, ick, suffix, pertaining to objects large enough to be examined by the naked eye. Malaise, feeling of discomfort, uneasiness, often felt by a patient who has a chronic disease. Malformation. Mal, prefix bad. Format, root word, a shaping. Ion, suffix process. Process of being badly shaped, deformed. Malformation. Malignant, malign, root, bad kind. Ant, suffix forming. Bad, wandering, pertaining to the spreading process of cancer from one area of the body to another area. Maximal, maxim, root, greatest, all, suffix pertaining to the greatest possible quantity, number, or degree. Microgram, mcg, micro, p, small, gram, s, a weight, unit of weight in the metric system, 0.001 milligrams. Microorganisms, micro, p, small, organ, r, organ, ism, s, condition, small living organisms that are not visible to the naked eye. Microscope, micro, p, small, scope, s, instrument for examining, instrument used to view small objects. Milligram, mg, milli, p, 1,000th, gram, s, a weight, unit of weight in the metric system. Milliliter, mi, milli, p, 1,000th, liter, s, liter, unit of volume in the metric system, 0.001 liter. Minimal, minim, r, least, all, s, pertaining to the least possible quantity, number, or degree. Multiform, multi, p, many, much, form, s, shape, occurring in or having many shapes. Necrosis, necra, r, death, osis, condition, usually abnormal, condition of tissue death. Neopathy, neo, p, new, pathy, s, disease, new disease. Oncology, onco, combining form tumor, logi, suffix study of tumors. Pallor, paleness, lack of color. Palmar, palm, palm, s, pertaining to the palm of the hand. Paracentesis, para, p, beside, centesis, s, surgical puncture of a body cavity for fluid removal. Prognosis, pro, p, before, gnosis, s, knowledge, literally means prediction of the course of a disease and the recovery rate. Condition of foreknowledge. Prophylactic, prophylact, r, guarding, ic, suffix pertaining to, preventing or protecting against disease. Pyrogenic, pyro, combining form, heat, fire, genic, suffix, formation, produce, pertaining to the production of heat, a fever. Radiology, radio, combining form, ray, x-ray. Logi, suffix, study of radioactive substances. Report, relationship of understanding between two individuals, especially between the patient and the physician. Syndrome, syn, p, together with, dromes, s, a course. Combination of signs and symptoms occurring together that characterizes a specific disease. Thermometer, thermal, combining form, hot, heat, meter, suffix, instrument to measure, instrument used to measure degree of heat. Topography, topo, combining form, place, graphy, suffix, recording, description of a body part in relation to the anatomic reaction in which it is located. Triage, sorting and classifying of injuries to determine priority of need and treatment. Abnormal, ABMS, American Board of Medical Specialties. AC, acute, AMB, ambulatory, AX, auxiliary, BX, biopsy, C, centigrade, Celsius, CM centimeter, CV cardiovascular, dermatology, DX diagnosis, ENT, ear, nose, throat, otorhinolaryngology, laryngology, FACP, Fellow of the American College of Physicians, FACS, Fellow of the American College of Surgeons, FP, Family Practice, G, Graham, GI, Gastrointestinal, GIN, Gynecology, KG, kilogram, L, liter, MCG, microgram, MG, milligram, ML, milliliter, neurology, OB, obstetrics, ORTH, orthopedics, PATH, pathology, PEDS, pediatrics, psychiatry, psychology. Medical and surgical specialties. Today, the practice of medicine involves many areas of specialization. The American Board of Medical Specialties, ABMS, was founded in 1933. This board established standards for the monitoring of specialties practice areas. A physician who met standards beyond those of admission to licensure and has passed an examination in a specialty area becomes board certified. Various medical professional organizations establish their own standards and administer their own board certification examinations. Individuals successfully completing all requirements are called fellows, such as Fellow of the American College of Surgeons, FACS, or Fellow of the American College of Physicians, FACP. Board certification may be required by a hospital for admission to the medical staff or for determination of a staff member's rank. See Table 1.1 for selected medical and surgical specialties, and Table 1/2 for types of surgical specialties with description of practice. Selected medical and surgical specialties. Specialty physician, scope of practice, concentration, work parts. Allergy, immunology. Diseases of an allergic nature. Immune, log, study of, one who specializes. Anesthesiology, anesthesiologist. Appropriate anesthesia for partial or complete loss of sensation, and without esthesio, feeling, log, study of, one who specializes. Bariatrics, bariatrician, prevention, control, and treatment of obesity. Bar, weight, pressure, IATR, treatment, physician. Cardiology, cardiologist, diseases of the heart, arteries, veins, and capillaries. Cardio, heart, log, study of, one who specializes. Dermatology, dermatologist, diseases of the skin. Dermato, skin, log, study of, one who specializes. And endocrinology, endocrinologist, diseases of the endocrine system, the glands and the hormones they secrete. Endo within, crinal, to secrete. Log, study of, one who specializes. Epidemiology, epidemiologist, epidemic diseases. Epiapon, demio, people, log, study of, one who specializes. Family practice, FP, family practitioner, care of members of the family regarding of age, gender, or sex. Gastroenterology, gastroenterologist, diseases of the stomach and intestines. Gastro, stomach, entero, intestine, log, study of, one who specializes. Geriatrics, gerontologist, study of aspects of aging. Geronto, old age, log, study of, one who specializes. Gynecology, GYN, gynecologist, diseases of the female reproductive system. gyneco, female, log study of, ist, one who specializes. Hematology, hematologist, diseases of the blood and blood-forming tissues. Hemato, blood, log study of, ist, one who studies. Infectious disease, diseases caused by the growth of pathogenic microorganisms within the body. Internal medicine, internist, diseases of internal origin not usually treated surgically. Intern within, ist, one who specializes. Nephrology, nephrologist, disease of the kidney and urinary system. Nephro, kidney, log study of, ist, one who specializes. Neurology, neurologist, diseases of the nervous system. Nerve, log study of, ist, one who specializes. Obstetrics, OB, obstetrician, treatment of the female during pregnancy, childbirth, and the postpartum. The Latin word element obstetrics means midwife. Oncology, oncologist, study of tumors. Onco, tumor, log, study of, ist, one who specializes. Ophthalmology, ophthalmologist, diseases of the eye. Ophthalmo, eye, log, study of, ist, one who specializes. Orthopedic, surgery, orthopedic, orthopedist, orthopedist, diseases and disorders involving locomotor structures of the body. Ortho, straight, ped, child, ist, one who specializes. Otorhinolaryngology, ENT, disease, or laryngologist, diseases of the ear, nose, and larynx. Otto, ear, rhino, nose, larynx, larynx, log, study of, ist, one who specializes. Pathology, pathologist, study or structural and functional changes in tissue and organs caused by disease. Patho, disease, log, study of, one who ist, one who specializes. Pediatrics, pediatrician, diseases of children. Ped, ped, child. Iater, treatment, IATR, treatment. Ishan, ICIAN, Ishan, physician. Physical medicine and rehabilitation. Physiatrist, treatment of disease by physical agents. Phys, nature, IATR, Iater, treatment. Ist, one who specializes. Proctologist, diseases of the colon, rectum, and anus. Procto, anus, rectum, log, study of, ist, one who specializes. Psychiatry, psychiatrist, diseases of the mind. Psycho, mind, Iater, IATR, treatment. Ist, one who specializes. Pulmonary disease, pulmonologist, diseases of the lungs. Pulmonal, log, study of, ist, one who specializes. Radiology, radiologist, study of radioactive substances and their relationship to prevention, diagnosis, and treatment of disease. Radio, X-ray, log, study of, ist, one who specializes. Rheumatology, rheumatologist, rheumatic diseases. Rheumatism, log, study of, ist, one who specializes. Urology, urologist, diseases of the urinary system. Urination, log, study of, ist, one who specializes. Types of surgical specialties with description of practice. Surgery is defined as the branch of medicine dealing with the manual and operative procedures for correction of deformities and defects, repair of injuries, and diagnosis and cure of certain diseases. Cardiovascular CV, surgical repair and correction of cardiovascular dysfunctions. Colon and rectum, surgical repair and correction of colon and rectal dysfunctions. Cosmetic reconstructive plastic, surgical repair, reconstruction, revision, or change of the texture, configuration, or relationship of contiguous structures of any part of the human body. General, surgical repair and correction of various body parts and organs. Maxillofacial, surgical treatment of diseases, injuries, and defects of the human mouth and dental structures. Neurologic, surgical repair and correction of neurologic dysfunctions. Orthopedic, surgical prevention and repair of musculoskeletal dysfunctions. Thoracic, surgical repair and correction of organs within the rib cage. Trauma, surgical repair and correction of traumatic injuries. Vascular, surgical repair and correction of vascular vessels dysfunctions.